we can have a bigger impact in education for patients and for their families. We really don't do that very well in the general practice setting or in primary health care at all. It's left to the specialists that they're seeing or the palliative care people, whoever else. Really, we need to upskill in general practice and make sure we have more knowledge about those things and where to direct people and when to direct people, when to just, give them information.
Well, I think the best advice that I could give patients and their families would be to just become very informed. Find out what's likely to be expected from not just from your acute phase of treatment, but afterwards, the survivorship stage, what's likely to happen. Also finding out what resources are available to you. What can the GP and the practice nurse do? What can allied health professionals help you with? What other services, support services, or information you can access that's reliable and based on evidence?
The only advice I really need is to remember one phone number, and that's the Cancer Council helpline on 13 11 20. That's staffed by experienced and very well trained cancer nurses and palliative care nurses who can tailor a package of information for each individual caller with evidence-based information, and also link them into a number of support services. So we run a number of peer support programs where we can link somebody with a person with a similar diagnosis who's been down the road, but it's about 2 years ago since they finished treatment, so they've had that experience and they can talk about it with somebody who's newly diagnosed.
Empowering people to ask questions, making people know that they can and they should. It's about making sure that everybody gets the most out of every consultation. We encourage people to record consultations, to come with questions, to write down questions in advance. But it's also, outside of the clinical setting, making use of the huge amount of community-based resources. So the Cancer Council obviously has a telephone information line. It has access to a wide variety of evidence-based resources. And people need to be directed to what is high-quality information on the web. There's so much out there, and to be able to provide people with good quality resources is part of the solution as well.
The role of the multidisciplinary team in cancer care, as in any care of a patient with a chronic condition, is really to work together to provide the best possible care in a way that's going to be relevant to this one individual who has specific needs.
The role of the multidisciplinary team is really to be able to give holistic care to a person, because we know that cancer care is very complex care in that it affects people in very many ways, not just physically but psychologically, spiritually, financially. And to be able to give care to somebody and cover all those facets of care, you really need to have multidisciplinary care, so nurses, doctors, social workers, physiotherapists, OTs, chaplains, all sorts of people to be able to meet all the needs of the person.
A range of health professionals, including the person's general practitioner, are part of a team who provide holistic care of that person. So that involves a variety of medical staff, but it involves nursing staff, allied health, and is basically responsive to that person's needs. So if a person has a need to see a dietitian or a psychologist, then we provide that. And all of those people are part of a multidisciplinary team. It's about having a key person and introducing people, I guess, as part of the team as necessary. So if somebody has pain or difficult to control symptoms, we might say, well, the palliative care team are part of the people who are part of your care, and they're introduced in that way.
I think because it's not an area we've generally had a lot to do with, because we have seen them referred off, we need to upskill our knowledge base so that we can pass it on to them. And again, work with others in the team who are caring for that patient to give them the information they need.
The best way that a primary care nurse could support patients in an evidence-based way would be to make sure that all the advice that you're providing and the resources that you're promoting are based on evidence. So there's EVQ, as it's one of the websites that has a lot of evidence-based information. I personally use the Cancer Council website because, again, all the information and all their resources are based on evidence, but they also link to other reputable organizations that provide advice that's based on evidence.
I think it's about the primary healthcare nurses being armed with the resources that are out there. They can't be expected to have all that knowledge themselves because they don't see a lot of cancer patients in their practice, but they need to be aware of the services that they can refer patients and family members to, and also those services that they can use themselves. So the helpline is very much there for health professionals as well. If they need some information about certain cancers or treatments, they can ring the helpline and speak to the nurses, and we'll put a package together for health professionals as well.
I think there is an obligation on us to provide people with information, to provide people in primary care. If this is Mrs. Smith and Mrs. Smith is at risk of fatigue, then to provide that information, to say, these are the sorts of strategies we'd recommend, so that we can be sharing that care and speaking from the same hymn book, if you like. And so I think that we have to be able to provide people with information. We should be able to direct people to evidence-based information. Again, the Cancer Council has evidence-based resources. The Survivorship Centre has evidence-based resources. We spoke today about the Cancer Institute New South Wales having resources through their EVIQ website as well. I think it's very tough in primary care. As an oncologist, I only have to deal with cancer. I don't have to deal with asthma and heart disease and Parkinson's disease, all of which I know very little about. And we can't expect people in primary care to be experts in everything without giving them some guidance.